Dr. Acosta. What seems to be the problem today?
Well, I have a running race coming up, and my knee's been really bothering me when I run, so I just wanted to double check and make sure everything was okay with it.
Okay, have you been taking anything or doing anything for your knee right now?
I've just been taking ibuprofen.
Okay, well, it could be your ACL, MCL, meniscus, or even the bone, so we can set you up with an x-ray and blood work today because we have that in-house to make sure nothing's wrong. And when we get that back, we can find out whether you need an MRI or anything.
Okay, sounds good.
Okay. So we got your tests back, and they're kind of inconclusive, and we're getting an MRI machine next week, so we can have you wait till then to use our MRI in-house here. But as of right now, we're going to prescribe you with a high painkiller Vicodin and a steroid prednisone, just in case anything's going wrong that we can't see.
Okay, that sounds good.
Okay, well, I'll come back with your prescriptions in just a minute.
Okay. That sounds really weird. That's a lot of stuff without anyone knowing what's really wrong. I think I'm going to get a second opinion. Hey! I just went to the doctor for my knee. I've been having some knee problems. And they gave me these drugs, and I don't really know what they are, and since you're a nurse, I didn't know if you could, tell me what I should do. They didn't find anything wrong with it, so...
These seem to be really strong for what you're looking for. These are really strong pain medication and a really strong steroid, and seeing as they don't know what's wrong with you, I think it's a good idea for you to get a second opinion, because these are really expensive.
Alright, thanks.
Yeah.
The problem is that patients can get confused easily when at the doctor's office. In a doctor's office, medical terms, and not layman's terms, are commonplace. For the ordinary person, it is easy to trust and not to question. Asymmetric information is defined as a situation in which information is unequally distributed between the individuals in a transaction. The person with more information will have an unfair advantage in determining the terms of any agreement. The agency problem is defined as a conflict that arises when a doctor, the agent, is entrusted to look after the interests of others, the patients. The problem arises when the agent uses the authority or power given to them for their own benefit instead. This is also called principal-agent problem or principal-agency problem. In our scenario, the buyer would be the patient, the seller would be the doctor. The doctor is selling their services to the patient, and the doctor has more medical knowledge and thus more information. Patients and doctors have a similar relationship as buyers and sellers, with some differences. Patients rely upon doctors to act in their best interests as their provider of healthcare. Patients expect their doctor to look at both ends of healthcare when addressing their needs. They are expected to act in a patient's best interests as a buyer of healthcare, and also act for their own interests as a seller of healthcare. In the free market, doctors are motivated by profit. This means that it is possible for doctors to exploit their patients by advising more treatment than is necessary. This is known as supplier-induced demand. Doctors, however, are licensed and act according to code. Sometimes this is not enough to keep them from maximizing profits. As we see in our scenario, our doctor prescribed various expensive treatments to be performed in-house. They also prescribed expensive medications to be taken by the patient. Our doctor was acting in her own best interests. This is an example of asymmetric information between buyers and sellers. Our patient was right to look for a second opinion.